An update that we just got today from NC DHHS. This is regarding Mpox. So this is a case where we're seeing there are some new wastewater samples showing that there's a new detection. It looks like it got picked up at a wastewater plant in Greenville, North Carolina. So we wanted to talk to health officials about this a bit more, just to kind of see what this means for the state and what folks need to know to stay safe as we go forward. So here to talk about that, we have Dr. Doran, who is Medical Director for Vaccine Preventable and Respiratory Diseases with NC DHHS. Emma, thank you so much for your time.
Yes, happy to be with you today.
So let's talk about Mpox for folks who have not been maybe thinking about this too much lately, because we know for a while during the pandemic on the tail end, this was certainly a big topic. But it's back now as far as in the headlines. And what do people need to know about Mpox? What does it do to the body, and how is this transmitted?
Yeah, Mpox, some people might know it by the former name monkeypox, and it's a disease that is caused by the monkeypox virus, and there's two strains of that. We call those clades, and so there's clade 1 and clade 2. They both spread the same way, and they can be prevented the same way, but Mpox is usually spread through close contact. Usually that's skin-to-skin contact, but sometimes that's through sexual activity, and it can cause quite serious clinical presentation. And as you mentioned, in 2022, we had a large outbreak, and that was clade 2. And so this new detection is clade 1. So wanting to make people aware of this new clade that we have found this detection for in North Carolina.
So as far as what folks need to know about this wastewater sampling, I mean, I definitely remember, doing a lot of reporting back during the COVID pandemic when I think maybe a lot of folks in the public became aware that, hey, you can test for a lot of different viruses by testing the wastewater that's going through these treatment plants. And so we saw that being used for COVID. In this case now, we see Mpox being detected at a plant in Greenville. So what does that mean as far as people in that area, or even just beyond, greater state of North Carolina? What do folks need to know at this point, given, I guess, since it is a different clade, as you mentioned, from the cases that have been previously confirmed here in the state?
So I would say, I think you gave kind of a great example. We used wastewater testing in COVID. And so for Mpox, it really just gives us kind of an early warning that we might be seeing transmission of this new type of Mpox in the state. Wastewater is not the water that you're drinking, so there's no risk of infection from the wastewater. These virus that we're detecting is kind of broken down particles, and we can't really say if it's one case or more than that, but we do think it means that there's probably an unidentified case that is in that part of North Carolina.
Are there any specific risk factors for contracting this? Are there certain groups that might be at higher risk of catching Mpox, if you will?
Well, for clade 1, there's a very large outbreak occurring in Central and Eastern Africa at the moment of clade 1. And so we've only seen 4 cases of clade 1 Mpox so far in the United States, and all of those cases were travel related. So I think there is still a good chance that we are seeing a travel related case here in North Carolina. So travel to Central and Eastern Africa would be one of the risk factors. Clade 2 risk factors were a little bit different, and we saw that trans more in the gay, bisexual, men who have sex with men community, and that might still be a risk factor, but those 4 clade 1 cases that we've seen elsewhere in the United States were travel related.
Now, I was just curious if we could talk about the wastewater surveillance in general, just because this is a really interesting concept for me. Of course, we talked about it being used for COVID, and in this case, Mpox. And I've been seeing a lot of reporting coming out of Texas where they're dealing with the measles outbreak, where it looks like there are health authorities that are testing the water out there specifically for measles. So I'm just curious here in North Carolina, what sort of viruses that we can test for in the wastewater. Is this something where, you have to decide that you want to test for a specific virus and then set up the system for it? I'm just curious how that works.
So we have the North Carolina Wastewater Monitoring Network here in North Carolina, and we have many utilities sewer sheds throughout the state that help us with this detection. And currently we test wastewater for COVID, for flu, for RSV, and for Mpox. We can definitely stand up some testing for some other diseases that are of interest, but it does take a little bit of time to develop kind of the assays and the ability to test for that. It's still the same kind of sampling, but the lab side to test for those different viruses, it can be a little bit of work. But one new way that we've been using wastewater in North Carolina, in addition to looking at the 2 specific clades of Mpox, is also subtyping our influenza positives, our influenza A positives specifically, to look for what type of influenza A is circulating and whether any of those are the strain that people know as bird flu or avian influenza. So we definitely are North Carolina's wastewater testing that is a center of excellence, and so we're kind of on the cutting edge of that, but still finding new viruses to test for, working on kind of the lab side to expand the viruses that we can test for and the capacity for that. But I will just say that wastewater testing and monitoring is at risk. The funding for that is at risk given the federal cuts that have been proposed and that have happened recently. And so that's definitely something to note, because it is such an important early warning and public health tool that we have.
Yeah, I mean, I know that there are so many different diseases that health officials have been trying to keep an eye on. And in some cases, we talked about measles, trying to literally wrangle down cases and make sure that outbreaks aren't spreading. I heard you talking about influenza. Anecdotally, I feel like I still see people getting respiratory illnesses, in my circles. So I'm just curious. It feels late for me in the year as far as a flu season goes, but I mean, is this something that is still going on? Do you think people should be getting their flu shots if they haven't already? Once again, I know that feels late in the year for that, but is that something you're still recommending for folks?
Yeah, we are coming out of the flu season, but the flu season tends to kind of have a long tail. So there's kind of a slow decrease in flu activity. We are still seeing some COVID activity. We didn't have a huge peak of COVID this winter, and so we're still seeing activity there. So you could be seeing that. And there are also rhino and enteroviruses that cause respiratory disease. So certainly talking to your doctor about what vaccines they'd recommend. Some individuals are recommended for a second COVID shot during the year. So I'd have that conversation with your provider about what might be right for you in terms of vaccines to protect you against respiratory disease at this point in the season.
All right. We appreciate your insight, Dr. Emma Doran, once again with North Carolina DHHS. I know I threw a few extra questions at you. We wanted to talk about Mpox. We certainly covered that, and then just kind of got curious about some of the other diseases that we're following in the state. So thank you for elaborating on those as well.
You're very welcome.